Hey guys, if you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First off, it's free. Secondly, there's creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcast, and so many more. You can make money from your podcast with no minimal listenership. It's everything you need in a podcast in one place. I absolutely love it. So make sure you download the free Anchor app or go to Anchor, ANCHOR.FM to get started. Hey guys, welcome back to Baby Bump Life's podcast. This is Nurse Wit here again, and for episode 3, I would like to talk to you guys about what to expect when you get to the hospital and you're in labor. I think it can be somewhat overwhelming when you first get there, so I just wanted to kind of talk to you guys about a couple of things so that maybe it would help kind of ease your mind a little bit. The first thing that they're going to do when you get there, they'll have you fill out a piece of paper or, maybe a little sticker or something like that just to identify your name, date of birth, so that they can get you into the computer system. Once they do that, they'll have you go into the triage area, change into a gown. They may possibly ask you for a urine sample. The reason that they want to do that, they may want to dip your urine to see if you have any protein in your urine, if there's any kind of infection, like if you have a UTI. So they may ask you for a urine sample. Then they're going to have you get into the bed, and they'll put the monitors on your belly. One will be for baby's heart rate to monitor, and the other will be for your contractions to see if you're having any and how long they're lasting. And then they will also check your vital signs as well. They want to make sure that everything is stable, your blood pressure is okay, heart rate, temperature, everything like that. Once they have those things done, then if you're there for labor, they may ask to check your cervix. It would be super nice. I tell moms this all the time. It'd be so nice if we could just look at you and say how far dilated you are, but unfortunately, we can't do that. Science isn't there yet. So the only way we know how to do that is to check digitally with our fingers rather, and to be able to tell how far dilated you are. I'll talk about in another video about cervical checks and dilation, effacement, pelvic station, all of those things, but just know that they will check your cervix so that they can determine if you are truly in active labor, or if maybe it's early labor, they need to watch you for a little bit. Maybe they'll send you home and you can come back later, and there's nothing wrong with that, but just know that they will check your cervix. Then if you are admitted for whatever, if it's for labor, or if they're if maybe you have another high risk issue that they are admitting you for, they're going to draw some labs on you. They're going to ask you some admission questions. And last but not least, they will have you sign a bunch of consents. Some of the consents they'll have you sign are just a basic to treat consent. Do you want blood products in case of an emergency? Basically, if you couldn't talk for yourself, would you want blood to save your life? Then they'll have you sign a consent about baby, just about their hospital rules and baby. And then they may have you sign some other hospital-specific consents. So just know that there will be some paperwork you'll need to fill out a little bit. If you have not registered, or pre-registered, I should say, at the hospital, you should probably do that. I talked about in my last video about things to do while you're pregnant to prepare for baby, and one of those things was to take the hospital tour. Typically at the tour, they talk about the pre-registration, so that's a good idea to do, because you do not want to do that when you're in pain and labor and you don't want to have extra paperwork to do. So if you can pre-register, that gets some of the paperwork out of the way. So those are just a few of the things to expect. Once you are admitted, they will take you to your labor room, and then depending on the hospital, they will get things started from there, get an IV going, and depending on where you're at in your labor process, your nurse will talk it over with your doctor, and they will discuss with you their plan of care from there on out. So I hope that helps you guys about what to expect a little bit when you do get to the hospital. If you have any questions, please feel free to contact me. Follow me on social media. I'm on Facebook, Instagram, Twitter. You can also email me as well with any of your questions, and catch us on YouTube as well at Baby Bump Life. So I will talk to you guys all very, very soon. Thank you so much for listening, and have a good day.